Okay, guys, as I was telling you, we were going to have our theoretical class first, and then we get started with our practice class, okay? So let's do it. The topic that we're going to discuss today is epidemiology, okay? Okay, so classically speaking, so this actually means like former definition of epidemiology, okay? And according to what the three main parts of the word are related to, we're going to talk about epi, okay, which means upon or among. Mhm. Then we have demos, which actually means people. In ology, it's science. So uh, if we are classically speaking, epidemiology is actually the science which deals with what falls upon people. Okay, a more modern definition would be related to this. This is actually the study of the distribution and determinants of health-related states and specified populations, and the application of the study to control health problems. So basically, what we're trying to say is that a person who is searching for some applied knowledge will be able to apply this knowledge that has already been acquired in health service. Okay, there are three main objectives in epidemiology. The first one would be to describe this distribution and magnitude of health and disease problems in the population. The second one would be to identify the etiological factors, risk factors in the population. And the last one would be to provide the data essential to planning, implementation, and evaluation of services for prevention, control, and treatment of determined disease. So here we just talked about the main objectives. However, we have an ultimate aim. Can anybody tell me what aim is? This would be actually the main objective, okay? That is an aim. In Spanish would be apuntar, okay? So what would be talking about when we refer to this? We would be talking about to eliminate or reduce health problems or its consequences, or to promote health and well-being of society as a whole. So we're going to be talking about some terms that might be useful for you. So what is incidence? It is actually the number of new cases of a disease which come into being during a specific period of time. And there is actually a formula that you can see right beneath the concept, which would be the number of new cases of a specific disease during a given period of time divided by the population at risk at that period, and you multiply that by 1,000. And that's how you get the incidence, okay? The next concept would be prevalence, which is actually the number of current cases taking into account the old and new cases of a specific disease at a point of time. And it actually helps to determine a burden of disease. Can anybody tell me what burden is? Maybe it's translation.
is like carga, peso.
Yes, great. Thank you. That is actually burden, carga. Okay. And it helps us to identify potentially high risk populations. Some other terms that you might have to get to know: an endemic. Actually, here we have some different concepts that might be related to each other but have different meanings, right? An endemic is a constant presence of a disease in a given population. For example, here in Bolivia, we have tuberculosis, right, which is endemic. Can anybody tell me from El Salvador what kind of endemic disease you might have, you might know of?
I don't know, but an example could be dengue fever. It's really sounded when we're talking about illness.
Okay, great, thank you. So, what would be an epidemic? It's an outbreak, okay, of occurrence of one specific disease from a single source in a group population, community, or geographical area in excess of the usual level of expectancy. So, an epidemic is like a disease that would be normally found, but it is considered an epidemic when the number of cases is above the usual number. Okay, it is well understood, right? And a pandemic, actually, what we're living right now, right? It is an epidemic that is widespread. Can anybody give me a definition of widespread?
It wouldn't be something like affects a big amount of people.
Okay. In Spanish would be difundido, right? Okay. Which is widespread across a country or a large population, possibly worldwide. This is actually what we're living right now, these 2 last years, right? So those terms are great for you to know. Sorry. So we're actually going to make a difference here between epidemiology and clinical medicine. Epidemiology, when we're talking about epidemiology, it is actually the unit of study is defined population or a population at risk. On the other hand, we have the clinical medicine, which in which the unit of study is case. Okay, the concerned at risk um, is well, the concerned with sick as well as healthy. In clinical medicine is the concerned with only sick. Okay, when we're talking about epidemiology, we would compare both healthy and sick people, and we're talking about clinical medicine. We're only talking about sick people. In epidemiology, the investigator goes to the community, and in clinical medicine, the patient comes to the doctor's consultation, right? And in epidemiology, we have to identify the source of infection, mode of spread, and etiological factor, future trend, or recommend control measures. On the other hand, in clinical medicine, we seek the diagnosis, we get to talk about the prognosis and prescribe a specific treatment. So here we have three main characteristics that are examined to study the cause for disease in analytic epidemiology, and these are the host, the agent, and the environment. With these main three characteristics, we can build actually a pyramid, which you can see here. Okay, so we consider the disease based on these three main parts. So there are some host factors, which is the one above the pyramid, right? And some host factors are behaviors, comportamientos, right? Genetic predisposition and immunologic factors. Can anybody give me an example of any kind of disease in which these main three factors could act? Okay, Danitza Burgoa, you didn't talk so far, so hello, Danitza, are you here? Okay, guess she's not. And what about Mariana? Okay, so we just
Well, an example about behaviors, just behavior.
how these three main factors would interact to determine any kind of disease. Could you give me an example?
Um, I don't know if my example is going to be right, but I'm going to try. Like, for example, in pneumonia, in each case that a person in his or her daily life consumes maybe tobacco or something like that, but doesn't get the disease, it could be caused because of an immunologic factors, but it has a bad behavior. Like an example.
Okay, so okay, that would be an example about behaviors, right? Okay, thank you. As and some of well, how these three main factors would interact. For example, when we have a patient with diabetes, right? For example, when a person has some relatives that also have diabetes, this patient might be more, might have more chances to get the disease due to genetic predisposition, right? And related to behaviors, this patient would not have a healthy daily life, not exercising and eating too much carbs, okay? And some immunologic factors, as for example, in this, well, there are some syndromes, okay, that might be related to an immune response directed to a certain disease, to a certain organ actually. So in type 1 diabetes, for example, um, there are antibodies that are related to the beta cells inside the pancreas, or um, antibodies that are directed to the insulin molecule. Okay. And for instance, there would be a genetic predisposition related to the creation of those antibodies. And when we're talking about behaviors, as I was telling you, maybe this person might have not the best behaviors, such as not eating healthy and that kind of stuff. So those three main factors may interact with each other to make our patient at a higher risk of getting this kind of disease. So there are also some agent factors, such as biological factors, physical and chemical factors. For example, in chemical factors, any kind of substance that might be around a person's job to get, for example, some sort of, for example, asthma could be related to some specific substances around a person's working area. Okay. And the environment, which means is related to external conditions, such as diet and lack of exercise, for example, that would be actually related to the environment. So the epidemics arise when the host, the agent, and the environmental factors are not in balance. And how would this happen? It would happen due to a lot of factors, such as due to a new agent, due to the change in existing agent, infectivity, pathogenicity, and virulence, due to change in number of susceptible in population, or due to environmental changes that affect transmission of the agent or growth of the agent. Here we have some a little bit about some studies that you might have to read because you're uh, already students. So we have, according to the methods, uh, an investigator uses. These methods could be classified as observational studies and experimental or interventional studies. The observational studies could be both descriptive or analytical. And on the other hand, the experimental or interventional studies could be randomized, control studies, field trials, and community trials. Can anybody tell me what kind of study has a higher level of confidence? I mean, which one of these types of a study could be or could give you better data for your general practice? Hello. Okay. What about Marcela?
Could you repeat the question, please?
Sure. Which one of these study types would give you better information for your general practice? I mean, which one of these types of studies have a better confidence level?
I don't know. I think court studies.
Sorry?
I'm not if I'm right, but I think court studies it will help well, it will help me.
Okay, actually, experimental and randomized studies, random control studies are the best ones. When you try to, for example, get the efficiency of some treatment, you actually have to look for randomized control studies. Okay, this is the best one actually, guys. If you want to read anything about any treatment that you might be interested in, or if you have any kind of doubts about comparing one or another treatment, you want to compare both treatments, you have to go after randomized control studies because they actually mm, have, well, as its name is already telling us, have control groups. So they have a group in each study that has healthy people, and these both groups could be divided into many other groups according to the age, according to the sex, according to several conditions related to the patient. Okay, and right after they give some sort of treatment to to a specific group of people, and then and right after they finish the study, they compare the results, and they actually have a better confidence level. So if you, as I was telling you, if you want to go after any kind of treatment and you want to know which one is better, you have to go after the randomized control studies. Okay. So as we were saying here, the descriptive observations pertain to who, what, where, and when of health related state occurrence. However, the analytical observations deal more with the how of health related event occur. And as I was telling you, the best one is a randomized controlled trial, often used for new medicine or drug testing. As I was telling you, for you to get better results with your patients, as this slide is already telling you, it is used for new medicine or drug testing. In field trials conducted on those at high risk of conducting a disease, and on community trial research on social originating diseases. So the best one, as I was telling you, the randomized control trial. So the descriptive studies have a lot of steps in which they could be conducted as a descriptive study. A descriptive study forms the first step in any process of investigation, and these studies are concerned with observing the distribution of disease in populations. So descriptive studies are not the best ones, actually, because as its own name is already telling us, it only describes what has already been written. Okay. On the other hand, also, as I was telling you, we have the experimental trials or studies in which you can modify. There is nothing written yet. You are writing down your own experiment. That is what this is, experimental, right? And actually, the best type of study is an experimental and randomized. Does anybody know what random is?
Al azar.
Great. And how would you call that in a study in Spanish? Aleatorio, right? So if you find this type of study, you, in Spanish, of course, you go after estudios aleatorios con grupos de control. That is the best type of study, okay? So as I was telling you, this is a really short topic, and now we're going to our practice class, okay? I'm going to start sharing my screen. Okay, so we're going to get started with Paola. Right after is going to be Mariana, right after Brisa, Marcela, and the last one would be Danitza. Okay, give me 1 second, please. Okay, so I'll see you please at the end of the class for the survey, okay? So we're going to get started with Paola. Hello, Paola.
Hello.
Hey, how are you doing? Okay, give me 1 second.
Okay.
Okay, from now on we have your 15 minutes, okay? So yesterday we've been talking about medical history. Could you tell me a little bit about how, well, you could relate a medical history, telling me the parts of medical history and relate it to a patient, and this patient might have any kind of disease that you might choose. You can choose any disease you want, and you can tell me how the patient is going, how you're going to describe the patient in your medical history. Let's say you're on your shift and you get a patient. You tell me what kind of disease your patient has, and tell me how you would write down your medical history.
Okay. First, I want to describe a core 65. This topic is was very interesting for me, and I investigate this core 65, right?
Yes. Okay.
Uh, I would say in Spanish. I can say in Spanish.
Okay.
Investigué sobre, me pareció muy interesante el course 65 y por qué se le llamó 65, por qué se le llama así. Es por mayores, pacientes mayores a los 65 años y pues sirve para predecir la mortalidad de un paciente a los 30 días. Desde que se ha diagnosticado la enfermedad, en este caso la neumonía. No sé si se puede hacer de otra, así, otras enfermedades, así como el COVID o otras enfermedades así.
Okay. This is actually for bacterial pneumonia. Okay.
Yeah.
Okay. So, do you know what each letter stands for?
Sorry, what?
Okay. Do you know what you said in the curve 65, right? So it has CURB. Do you know what each one of those letters mean?
Yeah, in Spanish, but, C is confusión.
Great.
U is urea, mayor a 42 miligramos por decilitro.
Great.
R, I remember that is respiración.
Okay, and what is
mayor
the number right there? And respiratory rate?
30 respiraciones por minuto.
Yes, 30. Okay, and B?
I remember is presión sistólica menor a 90 milímetros de mercurio y diastólica menor o igual a 65 milímetros de mercurio y pues 65 edad mayor o igual a 65 años.
Okay, great. So, and those letters are actually based on the English names, because B
Yeah.
actually means blood pressure, right?
Yeah.
Okay, great. And do you know how you would, I'm going to say in Spanish, cómo interpretarías los resultados? Cada uno es un punto, ¿no es cierto? Cada uno de los ítems del Club 65 es un punto. Entonces, ¿cómo lo interpretarías ya teniendo una
Busqué eso y encontré de 0 a 1 punto, pues la mortalidad de 0.2 a 2.7% se considera como manejo ambulatorio. Y de 2 a 4 puntos, pues tiene una mortalidad de 6.8 a 27% y se considera como ya hospitalización. Y pues de 5 puntos ya mortalidad del 57%, ¿verdad? Y ya sería más grave ahí.
Y esa ya es para terapia intensiva.
Yeah.
Entonces, 0,1 puede ser tratamiento ambulatorio. 2,3 a 2,4, perdón, es paciente internado en sala común y mayor a eso ya es terapia intensiva. Okay, great. Did you ever hear about, there's another scale actually, which is, let me remember, the PSI. Have you ever heard of it? PSI.
ES?
PSI. PSI.
No, I don't hear it.
Okay, great. You just did great. You're the only one actually. And actually you're getting 1 extra point for the homework that I actually forgot about. And you're getting another extra point because you're always the one that is on time.
Thank you.
Okay, so and there's another scale, as I was telling you, which is PSI, which stands for its letters in English. It's Pneumonia Severity Index, el índice de severidad de neumonía. This is actually more related to the mortality of patients. And you use the curve 65 scale to determine where you're going to treat your patient. Okay, so you could read that. It's really interesting as well. Okay,
Okay.
okay. So let's get to business now. You can choose a disease, and you can tell me how you would write down your medical history according to your patient, your imaginary patient. Right now.
Asthma.
Okay.
It is very easy to see. Yesterday I heard asthma in 3 symptoms, right? And 3 ways. I'm making the history. Sorry. How do you say those?
Off.
Off. Okay. Will be so cough. And the other is dyspnea. I don't know.
Dyspnea.
dyspnea, right?
Dyspnea. Okay.
In English,
Yes, of course, in English.
dyspnea, sí.
Dyspnea. Okay. Actually, the main parts of medical history are the chief concern. Do you know what the chief concern is, right? El motivo de consulta. So, what would your patient go to your consultation for if your patient had asthma? Would be the
Yes,
cough, right?
yes. Cough, dyspnea, and fibrillance.
Okay, and
Fibrillation, sorry.
okay, the last one would be actually what you're going to find on the physical examination. So the chief concern in asthma would be cough and shortness of breath also, because the patient is not going to tell you I feel dyspnea. He's going to tell you I feel shortness of breath. Dificultad para respirar, sensación de falta de aire. That is shortness of breath. So the chief concern in asthma would be cough and shortness of breath. Okay. Okay. So what about the history of present illness? Do you know how the asthma is presented?
Sorry, I don't catch you.
Sorry.
Uh, uh, I don't catch you. What
Okay.
you say?
Okay, the second part actually, well, you told me
Ah,
about the chief concern, right? And then goes the history of present illness.
present, yes.
So it is la historia de la enfermedad actual. How would your patient describe this?
Um, I think is mm, I don't know. The if is the pertinent positives are fever, a sore throat, a pain or swallow. I don't know. A dyspnea. Um, I think that is a 65 to a female. I don't know, a female who presents to the health service physicians complaining of increased shortness of breath.
Okay.
Is with
Yes, actually, that is the main, the chief concern, right? So he goes to your consultation and tells you that, for example, uh, let me do it a little bit in Spanish, okay? Los pacientes con asma, ¿sí? Generalmente tienen atopía. No sé si has escuchado el término atopía.
no.
Ok, es una tipo de presentación de un paciente que tiene, no sé si has escuchado alguna vez el término, el pliegue de Denny Morgan.
No, sorry.
Ok, es un pliegue de piel en el párpado inferior, si no me equivoco. Mm, que ese signo tan pequeñito que es un plieguecito de piel en el párpado inferior te indica que ese paciente es atópico y la atopía es el principal factor de riesgo para desarrollar asma o cualquier enfermedad alérgica. Entonces, este paciente que tiene atopía puede desarrollar asma, puede desarrollar rinitis alérgica, puede tener alergias alimentarias. Entonces, ese pequeño pliegue de piel te puede dar bastante información, ¿sí? Entonces, te puede decir que el paciente ha tenido este pliegue de piel que generalmente no lo notan los papás, ¿sí? Eh, Tú lo ves y tiene,
Perdón,
hello,
this can be in the past medical history, the atopic disease
yes, it
from
could be, yes, because the patient could be telling you that it has been having some allergic reactions to some types of food, especially, for example, milk, for example, egg, Okay, so proteins that are related to allergic reactions. So in history of the present illness, the patient would tell you that, for example, when your patient runs or is practicing in any kind of sport, gets really tired and feels short of breathness. And you know why it would be in during the exercise? Do you know why?
No.
Okay. Um, los pacientes, bueno, nosotros tenemos, ¿no es cierto?, los cornetes nasales que cuando respiramos tienen la función de humidificar y calentar el aire que estamos inspirando cuando respiramos a través de la nariz. Entonces, mm, cuando un paciente está haciendo ejercicio y es asmático, obviamente no respira por la nariz, respira por la boca. Entonces el aire no se humidifica y no se calienta. Entonces a los pulmones llega, bueno, a las vías aéreas inferiores llega aire frío y seco. Y el aire frío y seco puede desencadenar el broncoespasmo, que es característico del, del asma. Okay. Okay, so that is why during exercise, your patient could tell you that feels shortness of breath. Okay. And what about family history?
The history of asthma, allergies, sinuses, I don't know, sinusitis.
Mm, no,
Sinusitis.
okay, family history, maybe it is related to both parents mostly. And maybe if the patient has some siblings, you know what siblings is, right?
Yeah,
Is
hermanos.
okay. So if the patient's siblings or have asthma too, your patient might be in more risk of developing asthma. And what would you find in review of systems? The last part, review of systems.
Um, I don't know. Reviews. I don't remember this review of symptoms.
Okay, it is in Spanish would be anamnesis por sistemas y ahí es donde tú preguntas si tiene síntomas direccionando tu diagnóstico. Por ejemplo, en este caso, en caso de un paciente asmático, no vas a direccionar tus preguntas más al apartado, no sé, gastrointestinal, por ejemplo, ¿no es cierto? Vas a dirigirlo a las preguntas más
Yeah.
respiratorias. Entonces, ¿qué preguntarías en ese caso?
Um, the first of all, I will say the social story. I don't know, the workplace, the first, right? And school characteristic that may infer with adherence social factors that infer with adherence, such as substance abuse, substance abuse.
Yes.
I don't
Okay.
know, social support, social networks. I don't know, level of education completed. I don't know, close to respiratory systems. I don't know. How do you say polvo?
Dust.
Dust. I don't know. Yeah. I first of all, um, these questions, right? These questions, the social history, the place, and the workplace. I don't know.
It could be, yes, if the patient works, for example, in some sort of industry that handles with some chemicals. Those chemicals would increase the asthmatic crisis. Okay, thank you, Paula. You were done with your 15 minutes, and I'll see you at the end of the class, please, okay, for the survey.
Thank you.
Okay, see ya.
See you.
Hello, Mariana. Hello. Mariana, I'm sorry, I can't hear you. Are you here, Mariana? Hello. Hello, are you here? Hello, Mariana, are you here? Mariana, are you here? Hello. Okay, sorry. Marcela, are you here?
Hi,
Hey, how are you doing?
I'm fine. How are you?
Okay, I'm fine, thanks. Okay, so from now on, we have your 15 minutes, okay?
All right.
Okay, first of all, did you read about the curve 65 scale?
Mm, not really, sorry. I
Okay,
didn't got the chance.
okay, don't worry about it. So, what we're going to do today is this, okay? You're going to choose a disease and you're going to tell me step by step, just the way we talked about yesterday, about an imaginary patient's medical history, as if you were the doctor and you were on your shift and received a patient who has a disease that you choose and tell me how you would describe on a medical history your patient's disease.
Okay.
Okay. So what kind of disease are you going to choose?
I can choose whatever I want.
Yes, any disease you want to.
Mm, I have mine, maybe Zika, because that's with most familiar in.
Okay.
So, I don't know how to start.
Okay, yesterday I told you that the first part actually in a medical history is the chief concern. Uh, in Spanish would be el motivo de consulta.
So
Okay,
I have to describe this like saying this patient came to me because he felt I don't know, fever and any other symptoms as that.
yes, just like that. So the chief concern um, is the first part, right? Okay, you can get it started.
So a patient came because he felt some headache and has some how can I say conjunctivitis? I'm sorry, I forgot the word.
Okay, don't worry about it. It's actually really close to the Spanish word. It's conjunctivitis. Conjunctivitis. Okay. Or
Conjunctivitis.
actually, patients are not going to tell you I have conjunctivitis. A few patients might be doing it, might be do it. However, they actually say pink eye. Remember pink eye?
Yes, it will be more like a sign and not a symptom, right?
Yeah. Yes. Great.
Okay. The patient also has a fever and some uh, how can I say dolor de articulaciones? Sorry.
Okay. Joint pain. Joint
Joint.
is articulación, pain, dolor, right? Joint pain.
And the patient also told me that he felt some joint pain. Yeah. So after that, we're going to pass about history of present illness or no.
Yes, that would be the next one. Okay. So on this part, actually, you describe in order, right? How it started, how it developed, how it is right after he came to your consultation. So in order, chronologically order.
Okay, so the patient told me that he started feeling like the joint pain like 3 days ago, and then he started feeling well with fevers, and 2 days ago he started with also with a conjunctivitis or mm, what else? I had a thought that it could be Zika because it's let's say because of the weather and because of the location.
Okay. And hemorrhagic disease, right? Hemorrhagic viral disease, just like dengue, right?
Yes. Well, you asked where which ones are the mostly epidemiological disease here in El Salvador are those ones.
Oh, really?
Yes, we have a lot of chikungunya and Zika and dengue fever.
And did you get any of those?
Not really, but I remember all my childhood seeing these campañas. I
Okay.
don't know how as
Campaigns.
campaigns about how to take some like like I forgot this word. I'm sorry, I'm bad in English right now, but medidas para evitar el contagio o que la propagación, bueno, que crezcan los zancudos.
Okay, measures would be medidas. Okay,
Okay.
measures to avoid mosquitoes growing.
So remember that those like measures to avoid the mosquitoes growing in all my childhood. So and what else? Let's it will continue with past medical history, right?
Yeah.
Okay, and past medical there is in this DC I don't know if it could be any past like let me think in past medical history I don't know could you help me with this
Yeah,
one
sure.
please?
Actually, you told me that these three diseases are actually endemic in your country, right? Because there are a lot of cases. So you could ask your patient if he or she has ever had one of those three main infectious diseases, right? And why would that be? Because sometimes patient can differentiate one from another.
So but I heard about that if someone gets infected has been infected in the past and it could be infected again now in the present but from a different from
Variant?
a different yes variant.
Yeah, it could be. Yes, actually, there are a lot of types of this hemorrhage virus, right? So
Yeah.
they tend to have similarities between each other.
Yes, it's a little bit difficult to try to difference at first which of one of these trees is the patient the patient has which one of these three diseases, or also it can has both or three of them at the same time. I heard about that. And I was
Oh, that must have been terrible for that patient. And how, and since they are so, they resemble to each other, how can you differentiate one from another? I'm asking you because I really don't know. Because here in Bolivia, at least in my well, where I live, actually in La Paz, we do not have that kind of viruses. At least not in the city. Uh, I might have heard sometime and that they found some of those in a really mm, outside outskirts of La Paz, but not really here in the city. And I don't know how you can differentiate one from another.
or well, I know that there well mostly of three of them has a mostly the same symptoms, but there is just like a few of them that you can say like, oh, it's this one or this one. I heard that if the fever it's over 40, it this you can say it's no Zika.
Oh, okay. So you can differentiate from one from another by the clinical features.
Yes.
Okay, and do you actually have any type of laboratory studies?
Mhm. I don't. I really don't remember about that. I don't know. Really, I honestly I don't know.
Okay, okay, that's great. What about the next one? The next step, which would be
family history,
Yep.
right?
Okay. Yes. The third one, family history.
I think this one it could be combined with social history because well, if you ask to the patient if someone of his or her family has the same symptoms or in the community, so it will help us like in COVID to see how many people it's has the same disease.
Yes, actually, yes, great. And any other subject you might ask your patient according to the um social history, maybe where he lives, if there's water around the places that this person lives.
Yes, exactly that one. You ask them about if there is any accumulation of water that it's not same, for example, or also like if it's a lot of trash over the city or something like that, it could help us to say like, okay, you have.
Okay, yes, actually, let me tell you, I got dengue, right? Here in La Paz, we do not have this kind of disease. However, I went to live to Santa Cruz, which has a more tropical weather, and I lived there for a year, almost a year. And actually, I got dengue because there were across the street there was a mechanic that had tires, llantas, right, that were cut in half, and there was water that accumulated from the rain. And I got to assume that this mosquito that bit me came from that accumulated water. So that's what I asked actually. What kind of mosquito is related to the transmission of this disease?
Mm, let me think. It's Aedes Aedes aegypti. It's
Ah,
mostly
it is. Okay. So when you get to, did you have your parasitology class so far?
actually no, well, this year I'm going to start with my parasitology.
Okay. So actually, one small part of that subject is based on entomology, right? You heard about it, right?
Yes, it's about for let's say blood studies
Sorry?
or wrong. It's like the study of the blood or I'm wrong.
No, not really. Entomology is actually entomología is actually based on the study of the some bugs that transmit diseases. For example, in this case, Aedes aegypti is a mosquito, right? And it's actually a vector. And when you get to that part at the university, you're going to see that there are several types of mosquitoes that are related to the transmission of a certain disease. In this case, Aedes aegypti. Choose. That's what I remember from my university years. My professor always told us that Aedes aegypti chooses only clean water and leaves its eggs in a certain angle. I think it was 45-degree angle between the surface of the water and the eggs. So there are some really interesting facts about mosquitoes and those vectors.
Yes, you know, actually, one of the measures here it's that put some chlorine in. Well, here I don't know how to say in other words, but the pila it's where you put a big amount of water. I don't know if you
Oh,
know that word.
I didn't hear it, but it's kind of interesting. Yeah, it
Yeah,
is
here.
actually a good measure.
Yes, you put like in the walls of the pila, you put some chlorine.
Oh, okay, great. Didn't hear about it. Okay, Marcela, we're done with your 15 minutes, okay? I'll see
Alright,
you at the end of the class for the survey.
okay,
Okay, see you.
bye.
Hello, Mariana. I guess you're having some troubles with your, I don't know if microphone or anything like that, because two students already participated with me. So you wrote to the what to my WhatsApp, right? Um, I think you're having some troubles here. Okay, so I hope we can fix it. Try to fix it, please, because I know that's a problem in your computer or microphone, because I had already talked to two students. Okay, please try to fix it. I will try it once right after Brisa. Okay, so uh, I hope you can fix it. See you later. Hello, Brisa.
Yes, hello.
Hey, how are you?
Good, thank you.
Okay, so from now on we have your 15 minutes. Okay.
Okay.
Okay, so yesterday we've been talking about medical history. This is what we're. First of all, let me ask something. Did you read anything about the curve 65 scale?
Oh, yes, I did.
Okay, what could you tell me about it?
Okay, the curve scale is to see the risk of the morbidity and when someone is with pneumonia. And the C is for the confusion, and the U is for the uremia,
Okay,
and the R is the times of breathing. V is for the blood pressure, and the 65 is because of the age. If it's more than 65, it, it is plus one, and it makes like 5 points. And if the person have 4 or 5, it's it has to go to the um UCI.
I see you, right?
I
Intensive care
see.
unit, great. And what about 0 to 1?
The treatment could be ambulatory.
Okay, an outpatient, that is what we call outpatient. Paciente ambulatorio. Okay, great. And what about from 2 to 4?
It has to be I don't know how to say intrahospitalario.
Okay, as following the same logic as outpatient, we have inpatient. An inpatient is un paciente internado. Okay,
Okay.
okay, great. So you got an extra point for your doing your homework. Okay, thank you. Did you ever hear about the PSI? scale. This is another scale actually related to pneumonia.
Um, I think it's for to see the severity, maybe.
Okay, it is actually pneumonia severity index, and that is where you're correct. And it is used to determine the mortality among at the end of 30 days. Okay, so if this patient has a higher punctuation in this scale, has more chances to end up in death. So it tells us about the possibilities of the patient to pass away at the end of 30 days. And on the other hand, we have the curve 65 that you already told me, and you did it great. It tells us about how you can treat your patient. It is more based on where to treat your patient. Okay, so the PSI tells us about the chances of a patient to pass away, and curve 65 tells us about where to treat your patient with pneumonia, both cases with pneumonia. Okay, so getting now to business for today's class. Yesterday we talked about medical history, right? And this is what we're going to do next. You're going to choose any type of disease you want to, and you're going to tell me step by step how you could describe your medical history according to your patient's disease. Okay?
Okay.
Okay, so what disease would you like to choose?
Could be diabetes.
Okay, diabetes, great. So the first part in a medical history is the chief concern, right? What would chief concern mean in Spanish?
Motivo de consulta.
Great, yes. So what would it be in diabetes?
Maybe that um, the person feel more appetito.
Okay, starts eating more, right?
Yes,
Okay,
and starts drinking more too, and they have uh, a lot of they go a lot to the bathroom to pee.
okay. Anything else?
Maybe they could have some ulcer that couldn't cicatrizar.
Wounds that couldn't, yeah, okay. So we actually have in Spanish las síncopes, right?
Oh yes.
Could you tell me about it? In Spanish, if you want to. I mean,
About syncopes.
oh no, no, las síncopes, polifagia, right? And those other P's. Have you ever heard about it, right?
Okay. Polifagia is comer en exceso.
Okay. Okay. What I mean is actually five P's, 5-letter P's, right? In Spanish, las cinco P's. So, la primera sería la que tú me dijiste, polifagia. La siguiente sería, la siguiente P sería,
Pérdida de peso.
great.
I think poliuria, maybe,
Oh, yes, great.
and I don't know, polydipsia.
Great. Awesome. And there's one more left.
Oh, I don't remember the other one.
Okay, you're going to find out for tomorrow's class, okay? Okay, so weight loss and all those things that you told me are just fine. Okay, so do you have an explanation for each one of those symptoms?
Like an explanation from the patient?
No, a medical explanation for the symptoms of your patient.
Mm, do I have to explain each one?
I think we'd better leave it for another class, right? We don't have that much time. Okay, so what about the next one, which would be history of present illness? How would it be?
Like the patient, my patient is not eating well, and it's and he have been gaining a lot of weight through this time, and uh, two, 3 weeks ago, and he got an injury, and it can't cicatrized well, and that's why he's coming to the doctor.
Okay, but okay, great. What about the next topic in medical history? Would be past medical history. What would you focus on past medical history?
I can focus if the if there is someone in their family, in his family, that has actually diabetes, or yes.
It actually would be on the family history part. What about past medical history? Oh, well, for example, a patient who has diabetes uh, are usually chubby patients, right? Overweight patients. So they tend to have hypertension, for example. They tend to have some other diseases. Can you think of any other disease that might be related or accompanied by diabetes besides hypertension?
Mm, if they are if they eat a lot of sugar, bread, maybe the majority of the people that have obesity could have diabetes.
Okay. Okay. So next one would be family history. You already told me, right? And the next one would be social history. What about it?
Maybe if the person works uh, with no physical moving.
Okay, physical activity, maybe.
Yes.
Okay, anything else here?
Mm, I don't know if it goes in this part, but the what the person eats could be.
Yes, diet is actually, yes, it is part of it. Okay, anything else?
No, I don't think so.
Okay, what about the review of systems? Anamnesis por sistemas. what would you focus on a patient with diabetes?
Mm, well, if the person comes for with visión borrosa,
Or,
I will try to ask about that.
okay, blurry vision. Blurry is Blurry, blurry vision, visión borrosa. Okay.
And I will ask you about the ulcer that the person has, if he or she has one.
Ulcer, feet, maybe feet ulcer.
Yes, I think. Oh,
Okay.
if the person smokes too, I think.
Yes. And why is that?
I don't know. It could be something wrong for that disease.
Okay. Smoke actually. Bueno, I'm going to say in Spanish. Cuando una persona fuma, hay alteración de la producción de óxido nítrico, lo cual causa una disminución en la capacidad de relajación de las arterias, de las arteriolas. Entonces hay una alteración en el endotelio vascular, lo cual hace que sea más propenso a tener lesiones de pequeños vasos, es decir, microangiopáticas. Por eso es que se relaciona con daño a nivel de retina, donde hay los vasos más chiquititos, ¿no es cierto? La retina, riñones, circulación coronaria. Por eso es una enfermedad microangiopática, es decir, de vasos, los más pequeñitos. ¿Ok? ¿Ok? Anything else?
Mm, we can see the cardiac frequency too.
Okay. And why would that be important? I mean, in this part, that is a review of systems, we actually are asking our patient. That is why it is anamnesis por sistemas. We are actually going to ask if our patient has any type of symptom. For example, you told me about blurry vision, and that was actually correct, because you're going to ask your patient if he or she has blurry vision of or any kind of defect on visual fields, right? And on cardiovascular system, it is actually really important. What would you ask your patient?
Maybe if that person is feeling chest pain.
Okay, it could be related. Okay, great. Okay. Have you, last question, have you ever heard about how, I'm going to, let me remember. La clasificación de Wagner de pie diabético. Have you ever read about it?
No, I don't think so. I don't think if it's okay, but I think it just classified if the ulcer is superficial o grande o profunda. Is that all right?
Yes, that is correct. It classifies the ulcer depending on how deep it is. Okay, so I'm not that sure, but I think it has 5 main levels, and in the last one you can see the bone. That is the deepest ulcer. You get to see the bones patient, and that is really awful. Okay, so Risa, we're done with your 15 minutes. Okay, you did great. Please join for the end of the class for the survey. Okay.
Okay, thank you.
Okay. Bye.
Bye.
Mariana, are you here? Hello, Mariana.
Hello, I'm
Hello.
sorry. I don't
Okay,
know what happened.
okay, don't worry about it. It happens. Okay, it has happened to all of us, I think. Okay, so from now on we have your 15 minutes. Okay. First of all, yesterday I gave you guys a piece of homework, which was if you could find out or read about curve 65 scale. Did you read about it?
Yes.
Okay, could you tell me a little bit, anything you want to about it?
Okay. Well, what I found out it was that this was a tool to um, almost like prevent or diagnose a community acquired pneumonia. Um, well, this has, I think, are five. Um, uh, like I don't know how to say. Um, like scores that we are going to examine in these kind of patients that have a community acquired pneumonia and are near to an emergency and has to be um, hospitalized. I don't know if I'm saying it right.
Okay. Um, and do you know what each letter means?
Yes, um, C is for confusion, uh, U is for urea nitrogen, the DR is for respiratory rate, B is for blood pressure, and 65 is about the age if it's more or equal to 65.
Great. So we actually have each one of those has well is related to 1 point, right? So we have to add up. We have to add the results. And how would you? I'm going to say in Spanish. ¿Cómo analizas el resultado del curso 65? O sea, ¿para qué te sirve tener el score, la suma de las variables?
Well, when we have this summary of all points about all the scores of the factors that are analyzed, well, we're going to know if there is a low risk of hospitalization or not, or it's on the other side a high risk. I think zero is very low risk. One and two are middle risk. There is an increase of the disease gets worse, of the patient's symptoms got worse, and 3 and 4 are a very high risk.
Okay, so if you get a score from 0 to 1, what you do with your patient.
Well, always I will keep an eye on him or her, but there is low risk and it wouldn't be always necessary to hospitalize.
Yes, so 0 to 1 score is actually telling us that you can treat your patient as an outpatient. An outpatient in Spanish would be ambulatorio. Okay, so 0 to 1 score is related to outpatient treatment, and from 2 to 4 is how would you, where would you treat your patient?
From 2 to 4?
Yes.
Well, this kind of patient would need an hospitalization because there is an increased risk of the patient to get worse and maybe in the worst kind of view could be death.
Okay, and what about a 5 score?
That is completely severe pneumonia.
And
Would
where,
have to go to the ICU.
great, ICU. 5 equals ICU. Okay, great. You get an extra point actually. Okay, so have you ever heard about the PSI?
PSI?
Yes.
I don't know.
Okay, it is actually on scale similar to the curve 65. However, it is related to the risk for a patient to pass away, and that means mortality. Okay, it is also related to pneumonia. PSI actually stands for Pneumonia Severity Index, Índice de Severidad de Neumonía. Okay, so for example, in this case, the PSI is telling us about the risk of a patient to finally pass away at the end of 30 days. Okay, and on the other hand, we have the curve 65, which tells us about where to treat your patient. So those two skills are going to be really useful for you. When you get a patient with pneumonia, you can classify your patient with the curve 65, uh, trying to find out where you're going to treat your patient. And if your patient has a severe pneumonia, you can go to the PSI to determine what are the chances for your patient to pass away. Okay, so that was your homework. You did it great. Yesterday we were talking about medical history, right? What we're going to do now is that you're going to choose any kind of disease, and you're going to tell me step by step, following the steps that I already told you yesterday, how you would describe or write down your medical history.
Okay. Can
Okay,
you give me a second to think about it?
okay, any kind of disease you want to.
Mm, I don't think I don't know how to say it in English. I completely forgot, but I don't know if it counts like disease.
Sorry?
I don't know if it counts like a disease, but the example I want to use.
Okay, for example,
Mm,
some people told me about diabetes. Some other people told me about, I think it was hypertension, hypertensive crisis, I think. Any kind of disease you want to. Not necessarily in an ER. No, the emergencia. It could be in your consultation, an unstable patient. For example, rheumatoid arthritis or any kind of disease.
I don't really know about a lot of details of some diseases.
But the
Uh,
basics, I mean,
um,
you just need to know the basics. For example, a patient who has asthma, that some people talk about asthma, and they said that the chief concern, which is el motivo de consulta, would be cough, right? Those are the basics. For example, a flu, un resfriado común, right? Some people go to consultation due to it.
okay,
Okay,
I'm going to try with
don't worry about it. I
flu.
mean, okay, don't worry about it. I know that it's not actually your own field, but you're still going to see patients and you're still going to get some consultations, right?
Yeah.
Okay, do it. I mean, it's only the two of us. I'm not here to judge or anything like that. You can do it.
Okay. Well, I don't know if you want me to act or just say the answers of the history.
Okay, let's see about the chief concern and motivo de consulta. What kind of
Mm,
disease you would you like to talk about?
okay. Well, the patient has a sore throat
Okay,
and
great.
a runny nose.
A runny nose, great. Awesome. Those would be the main ones, right?
Mm,
Maybe sometimes headache, right?
yeah.
Okay. So the next step would be history of present illness, la historia de la enfermedad actual. Here you describe chronologically, following chronological order, how it started, how it developed, and how your patient and why your patient went to your consultation.
Okay. Well, the patient went to a football game and and he screamed a lot. So he felt a little bit tired, but he thought that it would um go with time. But the next 2 days, he had fever, headache, and runny nose. And the fourth day, it started with cough and
Okay,
headache.
great, awesome. Actually, you did it better than most of mm, the rest of the people because you followed a chronological order. That is actually mm, how you have to describe it, following an order from how it started. For example, I've seen some interns at the hospital that mixed it up a lot. They start by the end and they just remember the patient told them that at the beginning, so they mix up a lot of information. So you did it great. Um, Past medical history would not be relevant here, right? Neither family history, social history, maybe.
Well, the soccer play, the soccer game was in the winter season, and the patient was had a drink before the game, so it may has been a little um, irresponsible because of the weather.
Okay, yes, that would be actually a social intervention, right? For the disease to show up. Okay. And what about the review of systems? What you would ask your patient based on, well, in Spanish would be anamnesis por sistemas, okay? So you, since this is a respiratory disease, right? What would you ask your patient?
Well, if there is fever, if he has felt fever, maybe if the cough is, um, I forgot the word, with mucus, I don't know,
Okay,
I
if
forgot how to
it's
say.
well, your patient is is telling you that he feels, well, has cough, right? This cough has
Mm,
been coughing. So you ask your patient if that cough is dry, right? Those
oh yeah,
dry, seca, right?
yeah,
Or productive
right, yeah.
cough. Yes, and
Mhm.
in a cold, in a flu,
And if
actually
he goes, mm,
they have a dry cough, right?
mm,
Okay,
or if he feels difficulty to, I difficulty to breathe.
okay. Shortness of breath, maybe.
Sure. Yeah.
Okay, great. You did great. I mean, I know it's not your field. That's why I understand. Completely understand. I think I'm a complete ignorant in your field, for example. And well, you did it great. We're done with your 15 minutes, and there's one more student left. And right after her, please join for the survey, okay?
Okay. Thank
Okay,
you.
thank you. See you later. Hello, Daritza.
Hello, doctor.
Hey, how are you doing? Um,
Not so. Okay.
why so
Okay.
so? What
Mm.
did anything happen to you?
Well, I assume I have COVID again.
You got COVID?
Well, I assume actually I did the rapid test like 4 days ago and it was negative, but I have like direct contact with a friend. We basically shared our glass, rooms. Like she stayed in my apartment like 3 days.
Oh, so
Mhm.
it's kind of possible you did get COVID, right?
Yes.
Uh, well, I'm sorry to hear that. I hope you get better.
Thanks.
Do you feel fine now, or maybe we can leave it for
Um,
Thursday?
um, well, I feel better now. I just have a sore throat, a little
Yeah.
bit of headache, but I can do it. At least the class, today's class, it's okay to you.
Okay, great. So we're going to make it quick, okay? Because it's already late too. Okay, so you missed, I think it was the ECG class, right? Practice class. I think it was the first one, right?
Um, Yesterday's class.
Okay, so you're going to, this is what we're going to do. Yesterday, I asked you if you could read about the Curve 65 scale. Did you read about it?
I wasn't in the class.
Okay, I'm
But
sorry.
yes, I was really bad yesterday. So,
Okay, so
but I remember Um, It's
Okay.
like a cell or something, right? In pneumonia or some pulmonary disease.
Yeah. Yes, it is actually, yes. It is a scale to determine where you're going to treat your patient. Okay, I think you read about it. Okay, so you missed the ECG practice class, right?
Yes.
Okay, so could you tell me anything you know about about an ECG? What is it used for? How many leads there are? I don't know, any characteristics related to the waves? Anything you want to about the ECG?
Oh, okay. ECG is um, the graphic presentation of the electric activity of the heart. We used the electrocardiograph to make the the ECG. In the ECG we have leads that are the D1, which has a negative pole and a positive pole. D2, also the negative pole and positive pole. D3, also both of poles. The the negative ones always no. D1 and D2 go to the right arm, and in D3 in the left arm. The positive ones, D1 in the left arm, D2 left leg, D3 left leg. Also the AVR lead in the right arm, the AVL the left arm, AVF the left leg, and the black one, I don't remember what it is. It's in the right leg.
Yes, actually, yes. The black one, right? It is. I don't know how to say it in English. Actually, it is el cable a tierra, right?
Yes.
Okay, great. So those are the frontal leads. And what about the precordial leads?
The precordial leads. Oh, okay. Yes. But they are called like electrodes, right?
Yes.
V1. There are 6. The V1 goes to it is in the fourth intercostal space. V2 a fourth intercostal space, but so yes, they are almost the same. V3, they yes, between the V2 and V4.
Yes.
V4 in the fifth intercostal space, E5, anterior axillary lane, B6, mid-axillary lane as well. But we talked about like some others, B7 to B8, no, B9. I don't remember.
Okay, so there are a lot of more than the regular ones, right? The most usual ones are from B1 to B6, right? And there are actually B7, V8, and B9, I think. And there are actually posterior leads, and there are actually esophageal leads. And those are not really common, but they could be used. And I actually didn't mention them in class. Okay, so what kind of diseases might be diagnosed, or what kind of diagnosis would be well related to the use of an ECG?
Well, it helps us to diagnose heart diseases. I don't know how to say arrhythmias.
Arrhythmias, okay, great. Okay, okay, as we're going to make it quick because I know you're kind of sick right now. So what could you tell me about an MRI? Because I think that was in the same class. What could you tell me about MRI?
Okay, MRI. Well, it's a medical. It's the magnetic resonance, right? Okay. It's a radiologic technique. They uses that use like radio waves, but I don't remember. It was something about the I don't know how to say it, but it was sort of like a chemical thing.
Okay, and
Okay.
what kind of diseases might be diagnosed with an MRI?
Okay. We can see images of the brain with this study that can help us to diagnose some MRI, like acute MRI, because like it shows us liquid, can be edema.
Yeah. Okay, great. Some cerebral edema, right? Some hemorrhages, right? Yeah, some other neurological diseases. For example, when we find Dawson's fingers. Did you read about or heard about Dawson's fingers ever?
Can you repeat that again, please?
Yeah, sure. Have you ever heard about Dawson's fingers?
Dawson's fingers.
Yeah.
I don't. I
Okay.
don't.
Okay, you didn't hear about it. Okay, it is actually related to multiple myeloma. You can find some zones of demyelization, known as the desmyelinization, in some parts of an MRI, and that is telling you about multiple myeloma. Okay, so it's kind of easy, right? Some neurological diseases could be diagnosed with an MRI. Okay, and what about, well, you didn't assist yesterday. So I think we're almost done with your 15 minutes. I'm going to let you rest because it's too late. I hope you get better. Um, please stay for the survey, okay?
Okay, doctor. Excuse me. And the other practice class that I missed, like today's class.
So guys, we're going to get started with the daily survey or poll, okay? And let me know when you're done so we can go to rest.
I'm done.
Okay, there is one person who didn't join for the survey. However, I think we're done for today and I'll see you tomorrow. Okay, guys, have a good night's sleep and well, see you. Take care.
Bye. Good
Good night.